Robert M. Bosar completed his doctorate in sociology at the University of Notre Dame and a postdoctoral fellowship in applied epidemiology with the Epidemic Intelligence Service of the Centers for Disease Control and Prevention. He is a professor in the Department of Psychiatry and Behavioral Neurosciences at the University of South Florida and directs the Healthy Minds Lab, where his work focuses on suicide prevention, injury epidemiology, digital mental health interventions, and risk modeling of mental health disorders. Monica H. Swan holds a Ph.D. in mile per hour in epidemiology from the University of Pittsburgh and a B.S. in psychology. She has served in high-level academic leadership roles, including Dean and Professor of Epidemiology at Virginia Commonwealth University. Her research centers on structural drivers of alcohol use, violence, HIV, and health disparities among adolescents and young adults in the U.S. and globally, including work in sub-Saharan Africa. Thomas R. Simon holds a Ph.D. in preventive medicine from the University of Southern California and a B.A. in psychology from the University of Akron. At the time of his federal service, he was Associate Director for Science in the Division of Violence Prevention of the National Center for Injury Prevention and Control at the CDC. His portfolio emphasizes youth violence, suicide prevention, and evaluating how policy and prevention strategies can reduce multiple forms of violence at the population level. Ernest E. Sullivan III is a physician specializing in emergency medicine and preventive/public health medicine, with board certifications. His practice and research have addressed trauma, injury, and preventive medicine contexts. He has served in settings focusing on injury prevention, emergency care, and public health surveillance. Julie Sinclair contributes to public health research on adolescence, health behavior, injury, and violence epidemiology. Exact current institutional details are less readily available, but her work encompasses data collection and analysis of youth risk behaviors and injury surveillance. Danae Bixler's professional background includes public health surveillance, emergency department injury monitoring, and epidemiologic data systems. Her contributions to research include coordinating injury surveillance, data linkage, and analysis in underserved populations. Kristen Wilson is a public health researcher involved in data collection, emergency department injury surveillance, and analysis of injury/violence risk in underserved or marginalized populations. Her published work contributes to understanding how injury, violence, and healthcare access overlap in vulnerable groups. Their study looks at the health and safety of people attending the 2005 annual gathering of the Rainbow Family of Living Light, a large, informal community event held in Monongahela National Forest in West Virginia. Researchers from the Centers for Disease Control and Prevention and West Virginia Health Authorities tracked injuries and illnesses among participants and interviewed attendees about their health and risk behaviors. Most injuries came from outdoor activities like falls or sprains, not from violence, though some drug and alcohol use was common. Many attendees lacked health insurance or regular medical care, and a significant number reported past trauma, depression, or substance use. The researchers concluded that while the event was mostly peaceful, it brought together a population with important health needs, and future host communities should plan ahead to provide basic medical help, preventative care, and crisis support near the gathering site. The introduction explains that the Rainbow Family of Living Light is a large, leaderless community that gathers annually on U.S. federal land for 2 weeks each summer. These gatherings attract thousands of people and have been the subject of previous investigations by the Centers for Disease Control and Prevention due to outbreaks of illness and injuries in earlier years. Researchers note that providing healthcare in such mass gatherings depends on a mix of social behavior, physical health factors, and environmental conditions like terrain and weather. Since earlier studies focused mostly on medical records rather than the personal health histories and risk behaviors of attendees, there was a need for more comprehensive information. This study was therefore designed to learn about participants' health risks, past experiences, and medical needs to help local authorities and health workers plan more effectively for future gatherings. The Rainbow Family of Living Light is a large, loosely organized community with no central leadership or official spokesperson. Each year, usually around the 4th of July, thousands of members gather for about 2 weeks on public land somewhere in the United States. The event's location changes annually and is announced only shortly beforehand through online forums and community networks. People from across North America attend to live communally, share food, and celebrate peace and unity in a temporary outdoor settlement. The gatherings are independent and self-managed, relying on cooperation among participants rather than any formal structure or authority. In past years, the Centers for Disease Control and Prevention, CDC, investigated several health issues linked to rainbow family gatherings, including disease outbreaks and injuries among attendees. For example, the CDC studied a shigellosis outbreak and monitored hospital admissions during earlier events, which involved thousands of people camping in remote forest areas. One previous assessment found more than 100 hospital visits from participants out of roughly 20,000 attendees. These earlier efforts help public health officials understand the kinds of medical and safety challenges that can arise during such large, informal gatherings held far from established health facilities. The researchers set out to do two main things. First, they wanted to keep track of any illnesses or injuries that occurred during the Rainbow Family Gathering to understand what kinds of medical problems people experienced. Second, they aimed to learn more about the participants themselves, their physical and mental health, personal histories, and behaviors that might affect their medical needs or willingness to seek care. By combining these goals, the study hoped to give public health officials a clearer picture of how to prepare for and support the health and safety of people at future gatherings. The researchers gathered information from several sources to understand the health and risks of people attending the Rainbow Family Gathering. They talked with volunteers from the group's informal medical service, known as the Center for Alternative Living Medicine, CALM, visited treatment tents, and reviewed hospital and emergency service records from facilities within 80 miles of the event. Emergency medical and hospital data were carefully checked for accuracy and cross-referenced to avoid duplication. In addition, they asked adults aged 18 to 39 to fill out questionnaires about their background, health, substance use, and experiences with violence or mental health issues. The Centers for Disease Control and Prevention classified this work as public health monitoring rather than formal research, meaning participation was voluntary, and verbal consent was obtained from everyone involved. For data collection, the researchers combined several sources to get a complete picture of the health situation at the Rainbow Family Gathering. They interviewed volunteers from the Center for Alternative Living Medicine, CALM, the group that provides on-site medical help, and also gathered information from hospitals and emergency medical services in the surrounding area. In addition, they distributed questionnaires to participants to learn about their health, behaviors, and experiences. This mix of interviews, medical records, and surveys allowed them to study both the types of injuries and illnesses that occurred and the personal factors that might have influenced health outcomes. The researchers also visited CALM's makeshift treatment areas during the gathering to observe how on-site medical care was being handled. These areas were set up as temporary first aid tents managed by volunteers such as herbalists, homeopaths, and emergency medical technicians. However, CALM does not keep written patient records, and external researchers were not allowed to document patient visits formally. As a result, the observations made there were informal, giving a general sense of the care provided but not detailed statistics or case data. This study found that 102 people linked to the Rainbow Family Gathering visited emergency departments during the event, which worked out to about one hospital visit per 100 attendees. Most of these patients were young men, and over two-thirds lacked health insurance. About a quarter of them were sick enough to be admitted to the hospital. Illnesses made up most of the visits, while injuries, mainly accidental ones like sprains and bruises, accounted for the rest. Common illnesses included skin infections, body lice, and breathing problems such as asthma. Emergency services also reported several incidents, most resulting in hospital transport, and one death occurred off-site. Survey responses showed widespread alcohol and drug use, frequent depression or past mental health treatment, and many participants reporting experiences of violence or abuse earlier in life. Despite these challenges, most respondents said they would be open to using preventive health services or counseling if such help were offered near the gathering. The discussion section explains that the 2005 Rainbow Family Gathering saw roughly twice as many emergency visits as the 1999 event, which shows that where the gathering takes place has a strong impact on health outcomes and service demand. The study notes that the group's own organization helps reduce pressure on hospitals. It provides food distribution, safe drinking water, latrines, volunteer medical support through CALM, and a form of community self-policing. Most injuries came from camping and outdoor activities rather than violence, confirming that the event is largely peaceful but still carries everyday risks. Because many attendees have no health insurance, the researchers emphasize the importance of setting up preventative and outreach health services near future gatherings. They suggest that these events could be used as valuable opportunities to offer health screening, mental health counseling, and substance abuse support to a population that often lacks access to regular medical care. The authors acknowledge several weaknesses in their study. Because CALM, the volunteer medical group at the gathering, did not keep written patient records, the researchers could not accurately estimate how many people received treatment on site or how serious those cases were. Hospital and emergency staff identified attendees informally, often relying on what patients said, so it's likely that some Rainbow Family participants were missed. The questionnaire responses were based on self-reporting, which can be unreliable if people forget details or choose not to share sensitive information honestly. Finally, because the survey participants were selected from a convenient sample rather than randomly, the results might not fully represent everyone at the gathering, limiting how broadly the findings can be applied. The study concludes that people who attend Rainbow Family gatherings often face serious health and social challenges, including limited access to medical care and higher exposure to mental health and substance use risks. To better support this population and reduce pressure on nearby hospitals, the authors recommend that local health officials, the RFLL community, and the volunteer medical group CALM work together in advance to plan appropriate services. They advise setting up on-site medical tents that can handle minor injuries, provide health screenings, share information, and connect participants to local clinics or hospitals when needed. Ongoing data collection and monitoring at future events would help public health agencies prepare more effectively, ensuring that both the community and host regions are better equipped to manage the health needs of such large, unconventional gatherings. The 2005 gathering took place in the Cranberry Glades area of the Monongahela National Forest, West Virginia. The Rainbow Family of Living Light, a loosely organized community of individuals committed to ideals of peace, communal living, and minimal hierarchy, convened their annual U.S. event on public forest land. Participants arrived in a mix of tents and temporary shelters, coming together to form a self-governed, temporary village in the woods. Food was shared in communal kitchens, drinkable water and sanitation were managed in kitchen and bath camps, and volunteer medical teams, such as the Center for Alternative Living Medicine, or CALM, offered basic care. The gathering was characterized by outdoor camping activities, communal kitchens, and shared spaces of music, art, and informal workshops. Amid this communal setting, the environment was rustic, remote, and reliant on participants' self-organization rather than formal infrastructure. The local Forest Service and host community were aware of the event, and in 2005 there was a minor dispute over permitting, though no major incident according to state sources. The logistics of gathering such a crowd in a wilderness setting brought health and safety challenges, including the need to monitor injuries, illness outbreaks, and the capacity of nearby emergency services. The attendees included many who reported prior health or social vulnerabilities, such as limited access to medical insurance and prior exposure to trauma. Emergency department data and survey responses revealed that injuries largely stem from camping and outdoor terrain activity rather than violence. The setting of the forest, the relative remoteness, the mix of participants, and the communal ethos shaped both the informal social dynamic and the public health concerns associated with the gathering.